Hi, everyone. Thank you so much for joining us. This is Maggie Walker, Associate Editor of Metaesthetics Magazine. We're going to go ahead and get started. We'd like to thank Aerolase for sponsoring this webcast. Today we will be discussing Reverse by Aerolase, a combination treatment protocol to correct and protect against skin aging. Our presenter is Bruce Katz, MD. Dr. Katz is one of the most sought-after board-certified dermatologists in the industry. A leading innovator, Dr. Katz frequently conducts clinical trials on the latest cosmetic services. He regularly lends his medical opinion to top media outlets including Cosmopolitan, Metaesthetics, and Dermatology Times. He has been recognized with distinguished honors such as the Real Self Hall of Fame Award, and he has been named repeatedly by Castle Connolly and New York Magazine as one of the best doctors in New York. If you have any questions during the presentation, please type them into the Q&A box in the upper right-hand side of your screen, and we will answer them at the end of the presentation. If we are not able to get to all of the questions, we will follow up with you after the webcast. Thank you again for joining us, and enjoy the webcast.
Okay, hi, Dr. Bruce Katz here, and our agenda for this webinar is as follows: how to address aging skin in younger patients, why these patients are important to your business, differentiating your practice with Reverse, marketing and selling the Reverse treatment, and then we'll go over some questions and answers later. So basically, there are a number of benefits from this new procedure called Reverse. First of all, to correct and prevent the signs of aging in a single, minimally invasive procedure provided by two complementary devices without using general anesthetic or even IV sedation. It's a full natural aesthetic result with simplicity and comfort, and we see a significantly reduced time to full results with a rapid return to daily activities. What does it solve? Well, we know skin aging is complex. It begins around the age of 30, sadly, but with characteristics of roughness, dryness, laxity, irregular pigmentation, collagen loss, wrinkles, and redness. And a combination of modalities is typically required, as we know, to achieve overall patient satisfaction. But the options have been limited, or, involving multiple devices becomes too complex. So Reverse advances what keeps our skin healthy. It utilizes two distinct full-field, non-ablative, and ablative laser modalities to completely address these concerns in a manner no other treatments really can achieve using these two technologies themselves. We see, number one, a more complete removal of the outer layers of aged and sun-damaged skin, and that's required to induce reepithelialization, the formation of new healthy skin, and this helps to protect the dermal layers of the skin. And number two, with the degradation of collagen, dermal treatments must stimulate new collagenation in order to get, more fullness and, stiffening or really tighter looking skin. Well, why did the company come up with Reverse? Well, we know that the patient's biggest facial aesthetic concerns are, number one, in 90% of people, the signs of aging. And then in 73% of people, uneven skin tone and pigment. So these are the major concerns that people have in terms of facial aesthetics. And in this survey by the Aesthetic Surgery Journal, they found a number of extrinsic factors that place more focus on the face than actually on the body recently. First of all, the Zoom effect, as we all know, with increased video chatting stimulated by the pandemic, this has really been correlated with an increased appearance concerns, and the initial lockdown restrictions correlated with a decrease in the aesthetic cosmetic plastic surgery case volumes. And public interest in above-the-shoulder surgical procedures showed a significant increase following February 2020 compared to below the shoulder procedures before that. And then we know another factor is social media impact, the rise of social media and people wanting to portray a flawless appearance. That really sends ablative and non-ablative skin resurfacing treatments up and to the right in coming years. So big emphasis is because of these extrinsic factors on the face, even more so than the body. And patients are in a unique position for aesthetics. Number one, there's been a universal increase in attention to aesthetic concerns. Number two, younger patients in the age group of 25 to 45 really want to get ahead of their future issues. They're looking at preventive treatments. Number three, middle-aged patients in the 45 to 60-year age group want to subtly address the aging concerns that they've noticed recently. And the older generation of patients over 65 are really phasing out as the biggest spenders. So a new generation of patients is really poised to significantly grow the aesthetic market. And there have been, two choices people usually had in the past. One was either, aggressive treatments, getting good results, but they were harsh, required a lot of downtime, they were painful. Or another in the spectrum was gentle treatments that offer little or no pain and little downtime or no downtime, but really give minimal to no results, really a do-nothing treatment. So reverse really delivers what modern patients want. It delivers great results, it's comfortable, there's minimal downtime, it's easily achieved. We see results very quickly, and we see long-lasting results as well. And there are really two categories of our patients. One, the first category is to prevent aging. Second is then to correct aging. And in the first category, and the age group of the 20s, we see collagen loss of about 10% and a reduction in skin thickness of 7%. In the 30s, we see collagen loss go to about 20% and reduction in skin thickness of 14%. And then it gets even more depressing. To correct aging, we see in the 40 age group a collagen loss of about 30% and a reduction in skin thickness of 21%. And in the 50s, about 40% collagen loss and a 28% reduction in skin thickness. So let's look at this procedure in more detail and the science behind the devices. First of all, we have the Neo Elite, and that produces, this device produces dermal remodeling and is non-ablative. It addresses chronic aging concerns such as collagen loss, rosacea, melasma, and sun damage, and then also acute conditions, acute concerns such as spider veins and active acne. The other device is Era Elite, and here we have an ablative device that produces epidermal renewal. It improves tone and texture, improves enlarged pores, and also improves rough complexions. So these two devices produce a complete solution to modern patients' needs. It reduces the appearance of fine lines, acne scars, and wrinkles. It decreases roughness and dryness. It diminishes hyperpigmentation, reduces erythema, and increases skin elasticity and firmness. So we see great results, again, comfortably done, minimal downtime, easily achieved. Results are shown very rapidly, and we see long-lasting results. So reverse is a two-step procedure. Basically, it delivers the energy deeply into the dermis in order to stimulate collagen. And this really acts as a foundation for long-lasting healthy skin. And it's a longer process. Results typically take, up to 9 months. And then we have Era Elite, and this removes the visible signs of aging and enhances the skin's signs of aging. Really, the results are visible within 2 to 3 days, actually, for really great patient gratification. So step 1, NEO is a 1064 nanometer wavelength with a 650 microsecond pulse duration. Again, penetrating deeply, stimulating new collagen for tissue tightening and brightening, and also breaking down unsightly red or brown discolorations from melasma, rosacea, sun or age spots, and acne. It provides high clinical efficacy without the pain sensation of other laser devices on the market. So it goes deeply into the dermis without trauma, and this allows for us to do multiple passes, 4 to 6 passes in one session to enhance the results. And this gentle treatment really allows ablation to be performed immediately after using Neo-Era. So why are the results dramatic and comfortable? Well, if you look at other lasers, particularly ones that have short pulses and low fluence, the short pulse is insufficient in terms of energy to cause a desired change to the target structure. And we don't see really much in a way of a desired outcome. And then on the other end of the spectrum, other lasers with short pulses and high fluences, we have sufficient energy, but it really creates more collateral damage because of the high energy. And then with the reverse, we have a short pulse with sufficient energy to cause a desired change in target structure, and this gets results we really want. And here we see Neo Elite. Basically, we'll do 4 to 6 passes across the entire face, and then you can actually do some spot treatments to more deeper areas and areas of concern. Step 2 is the Era device, which is a 2940 nanometer energy delivery device with 300 microsecond pulse duration. And this vaporizes the outer skin layers to smooth the skin surface and diminish wrinkles, acne scars, and other forms of uneven texture. And it's really the most efficient type of laser energy for gently removing tissue without collateral thermal damage. So it removes the stratum corneum and damaged skin for really very quick patient satisfaction. And here you see a comparison on the left where we have the Era ablative effect here, very short pulse, nice clean ablation, compared to long pulse erbiums where you have more residual thermal damage, and even more so with the ultra pulse CO2 and continuous wave CO2 as well. And basically with the Era Elite, we do one pass across the entire face. And if you think about it, when we use topical treatments for skin care, we treat the entire field, not just doing fraction delivery. So this full field effect using both of these reverse devices allows complete renewal and outer epidermis and deep dermal layers for dramatic results after just a single treatment. So basically, it enables comfort, rapid recovery, and excellent results. And you can do this annually. We can really help with the improvement in epidermis and strengthening the dermis to slow down the aging process significantly. Well, let's look at the clinical evidence and the results from the reverse treatment. So essentially, it offers rapid recovery, comfort, and results. The treatment itself takes 40 to 60 minutes. The recovery time, 2 to 3 days, very quick. And time to see results, usually 72 hours. Patients tolerate it, really well. 100% of patients tolerate it very well. And we've not seen any significant adverse events. And here are some of the studies we've seen. This is Kevin Pinsky's study, which he found in his study, subjects reported little or no treatment discomfort. For the dermal concerns, most patients reported noticeable improvement in at least 2 or 3 of the targeted conditions, including clearance of acne, erythema, spider veins or pigmented spots, as well as improvements in texture, including a reduction in size in several patients. And in this study by Gordon et al., they found a younger population with relatively mild photodamage can gain significant improvement in a shorter period. The authors suggest a treatment with the pulsed erbium YAG laser for people who do not want to experience more painful and extensive procedures. And rapid recovery. They found reepithelialization was complete in 2 days, only 2 days. In terms of the epidermal concerns, the improvement in skin tone, pigmentation, texture, fine lines, and wrinkles really resulted in epidermal reconstitution and remodeling of collagen that continues to take effect over a period of months. So we see really nice long-term benefits that are produced by the reverse treatment. And here you see a patient in her mid-30s. This is immediately after treatment, and then we apply a moisturizer. This is the morning after treatment. 2 days later, almost, complete reepithelialization, and 4 days later with really an excellent result. And here we see, again, her impression of the results. She said, my skin is bright, my pores are missing, and my texture is smoother than my youngest baby's bottom. That's quite a statement. And the rejuvenation texture honestly amazed her. And she said she had very little downtime and no pain. And she obviously was looking forward to her next treatment. And you can see the before here and after result with significant improvement in her skin. And here we see a patient in her early 40s, before treatment on the left. Immediately after treatment, you can see, obviously, the marks from the laser. This is one morning after, and then 5 days post-treatment again. Take a look here at the before photo, and then 5 days post-treatment with really a dramatic improvement in her skin. Another example here, patient in her late 40s, wrinkles on her forehead, before and after. So, patients in the late 40s, this is the typical comment they make. They said they definitely do it again. Their pigmentation, hyperpigmentation is gone. And, this woman was saying her skin actually glows. She said, at 47 years old, I can look in the mirror and love my skin once again. She said, I'm a very happy customer and will be doing this yearly to keep my face in the best shape possible. So just doing this on an annual basis, you have a recurring patient coming in just to keep up the benefits that they've accrued from the reverse treatment. And here's a patient in her 50s. Look at the, dramatic improvement in texture, wrinkles, pigmentation, before and after. And again, frontal view. Significant improvement, fine lines around the mouth, hyperpigmentation, lentigines, texture generally, tightening of the skin as well. So what does it look like in your office? Basically, it becomes a complete solution to your modern patient's needs. Again, reducing the appearance of fine lines, acne scars and wrinkles, decreasing roughness and dryness. It diminishes hyperpigmentation and reduces erythema. And it really gives an improvement in the skin elasticity and firmness. So we see great results. It's comfortable. There's really minimal downtime, 2 days, 3 days maximum, easily performed. The results are really quick, and we see them lasting quite a long time. So who are the patients really in most of our practices that would be looking for reverse? Well, patients already enrolled in a skincare regimen. Patients who would be asking, what's next for my skin? Patients who are getting fillers or Botox or laser treatments. and patients who want, longer lasting results from these complementary products. And then patients aged 25 to 55 without progressive aging, patients with mild to moderate photo damage, and patients seeking to prevent the signs of aging. So it's a great preventive treatment as well as corrective in addition. So these are some of the suggested package pricings based on the visible aging of your typical patient. So someone with zero or minimal signs of aging, they would need one combination treatment with a Neo and Era, and then 2 treatments with Neo. And this is the price tag you would see suggested right here for that treatment. And then here, a patient with subtle signs of aging, they were recommended 2 treatments with Neo and Era, and then 2 treatments with Neo alone. And then the suggested fee annually. And then patients with moderate signs of aging, 3 treatments with Neo and Era, and then 2 treatments with Neo alone. And this is the suggested fee range that would be suggested annually. And then we have questions and answers. Thank you very much for your
Thank you so much, Dr. Katz, for that wonderful presentation. We're going to go into the Q&A section now, which will be with Ashley Buckelman. All right. Hi, everybody. We're going to start the Q&A portion of this. So welcome. We have quite a few questions that we're going to jump into. Just as a reiteration, in case anyone's concerned, if we do not get to your question that you asked, and feel free to ask questions as we go through the Q&A. If we do not get through to your question, they will be answered after the Q&A is over, so the answers will still be sent out. Hi, so we are welcoming Ashley Buckelman for the Q&A portion. She is a nationally certified paramedical esthetician with more than 15 years of experience with laser technology in the medical spa, dermatology, and plastic surgery fields. We're going to jump right into it. So question number 1, can you do this treatment more than a couple of times a year?
You absolutely can. You're only going to benefit the more treatments you do. Obviously, you don't want to space them extremely close together. You want to let your skin re-epithelialize and heal. But you absolutely can do this more than a couple times during the year, especially if you are in an age bracket where you want to really help remodel some collagen and help superficial texture as well.
Awesome. What makes this different from other combination laser therapies?
Well, Aerolase, has the microsecond pulse duration, so it's great for all ethnic backgrounds. So with that being said, you can heal quicker, and it's like no other of its kind.
Awesome. With that kind of going into saying that it's good for all ethnic backgrounds, we did get a question about can ERA be completed on Fitzpatrick's 5 through 6?
It absolutely can. It depends on how you establish with that patient what their wants and needs and goals are. And then going from there, you obviously have to proceed with caution, but you absolutely can do this on all Fitzpatrick levels, 1 through 6.
Perfect. Are we really preventing aging with this treatment?
We absolutely are preventing aging with this treatment because of the 2 modalities that are working together. You're having the 1064 YAG, that's going to be the deeper of the 2, helping remodel collagen, elasticity, and firmness to the skin with rejuvenation, while you're then allowing your ERA, which is your 2940 wavelength at a microsecond pulse duration as well, superficially to help a lot with those textures, pigmentation irregularities, pores, and that also helps soften fine lines. So when you're putting both of those together, I always say it's like the perfect marriage because they blend so nicely together, hitting all of the levels.
Awesome. That's awesome. So we got another question. What would you recommend for daily skincare after a treatment like this to make the results last longer?
Daily, are you meaning once you're healed?
Yeah, I'm assuming so, yes.
Okay.
To help with the results and lasting longer, yeah.
Okay, so I always like to tell people at-home skincare is a must, especially if you are doing these treatments. I traditionally like to say that 80% of your skincare is at home and 20% of your skincare is with us clinically in the office. So making sure people are exfoliating properly with their skin, always putting on their vitamin C's during the day along with their sunscreens is a must because your skin is going to obviously reverse. So it might be a little bit more sensitive and you want to protect your investment by using correct skincare. Maybe some retinols in the evening, lighteners and brighteners. It just depends on the actual patient itself, and somebody should be able to customize a plan for them to keep these long-lasting results.
Awesome. How is the Aerolase downtime different than other ablative devices?
Again, that is because it's microsecond technology. So it allows the skin to be 100% ablated, but it can re-epithelialize very quickly as that microsecond pulse duration has went into the skin.
What are intervals between each reverse treatment?
That depends on the age of the patient and the condition of the skin. I typically say, at least doing 1 a year in your 20s, 2 a year probably in your 30s, and then 3 to 4 a year if you're, 40 or 50 or above. It just, again, it depends on, the environmental damage that's done to the patient, how their aging process is going, and the age of the patient.
Speaking of the age of the patient, are there any specific age groups that are not appropriate for this treatment?
I personally have done a treatment on an older teenager just for some of the scarring and active acne that they did have. But typically anybody in their 20s into their late 60s. But if somebody is in, their late 60s and they went too far where they haven't had the proper skincare prior, that, being honest with them is key. And if they're not a candidate for it and it's something like, more cosmetic surgery that they need, being honest with your patient's always going to bring them back. I always say if you're, you want something a little bit more in depth, if they go do that, then you've recommended that for them. They have your trust and they'll come back to see you to keep up with that and maybe doing a reverse.
Mm-hmm.
Yeah, so I'm going to jump in here just real quick, Ashley. This is Sean. I think it really depends on what you had said about where the patient lies within the aging realm. How well did they take care of their skin up till they were, if they're just starting skincare at 45 or 35, you're going to have to get them down to a realistic baseline to where you start from, and then you can obviously keep preventing that aging process to come. And I think that we've seen that. We were doing cases last week with one of our physicians in Westchester, and we had a bunch of different patients. One person that already had reverse, their skin looked phenomenal. Other people were at a different baseline. So it really depends on where that patient is. But that's kind of the nice thing about it is that you have these different patients that you can either take to a new level of rejuvenation or you can start them on it. And it's great for, all of these different patient segments.
Awesome. Can you treat the neck, chest, and hands with this treatment as well?
You absolutely can treat the neck, chest, and hands with this treatment.
Perfect. So we did talk about skincare after the skin has healed and kind of a skincare regimen and treatment, but what can you or what do you put on right after the treatment?
I personally customize a plan based with sickle fate from Aven. I love sickle fate with Aven just because it's antimicrobial, antibacterial, and antifungal. So as you've ablated that skin superficially, you want to make sure that you're keeping that barrier to where it's functional and the healing properties are taking place. So because you do have that antimicrobial, antifungal, and antibacterial property, you know that the skin is going to be safe. And you also have the zinc in there that will help protect the skin as well, along with a clinical sunscreen over the top.
Very nice. How many days between each reverse treatment should you practice?
In our practice, I typically tell people you want to wait at least 60 days in between your reverse treatments, just so the skin can re-epithelialize, heal correctly, and the results are starting to take place. And in between those reverse treatments, you can always do, 1 or 2 neos in between that time, just to help the process a little bit further and to reverse that aging process with stimulation of collagen and elastin.
Wonderful. How does crepey skin react to this treatment?
That's an excellent question. As long as you give patients realistic expectations and it's crepey skin, not, a lot of loose skin, crepey skin responds to this extremely well, because when you're remodeling the collagen underlying, when you're doing the first part of the procedure with the 1064 YAG, which is the Neo Elite, you're helping remodel that and helping that tissue response gain accessibility, and then you're bringing the Aera over the top of it to fully ablate. So it responds extremely well.
Wonderful. What kind of contraindication should we be looking out for this treatment?
Contraindications for this treatment obviously would be if they are doing a lot of topical medications prescribed from the dermatologist that could make their skin a little bit thinner, more so too much exfoliation prior. Another contraindication, you always want to make sure if somebody has like active psoriasis or eczema, obviously we clinically state that the Neo can really help with those conditions. However, when you're putting full ablation on top of those, that could be a counterindication. I always tell people another counterindication is cold sores. Make sure to be extremely aware of patients having cold sores and start them on the correct medication prior to treatment, and make sure that they're staying on it post-treatment so you don't have an outbreak of cold sores.
Very nice. We do have one more question, unless any more trickle in. Nope, there's a few more. Never mind, some more trickled in. But so another question that we do have, we have talked about, it being safe for Fitzpatrick 5 and 6, but we did get a question on how we can make this work for skin of color.
So the way that we make it work in our practice is obviously the Aera you can hold out further to make it a little bit more subablative than full ablation to the skin. And the darker Fitzpatrick levels, we want to make sure that they're comfortable and we have no chance of hypo or hyperpigmentation. So with skin of color, you want to just hold the Aera out a little bit further to make it more subablative. You're still getting those ablative properties, but you're doing it in a safe manner, so no skin of color will have any kickback with pigmentation.
Awesome. The gold standard is the Skiton Halo, even microneedling with InMode, luminous for resurfacing. How is Aerolase different than these?
Oh, that is a wonderful question. So, I'm glad you asked this question. So this, like I said, is nothing of its class. When you're working with a halo, you're working with non-ablative and ablative properties into one machine in one device, but honestly, it's not extremely customizable. So when you're working with full ablation here and you're working with a YAG laser, you can't really compare the two, since YAG laser is going to be the deepest in remodeling the collagen and the tissue response, and then you have your full ablation. Also, with a lot of those treatments, you're never going to get the same results as you do with this, but on top of that, a lot of those devices all have consumables, which this is one thing we absolutely love in our practice. There is no consumable cost with this procedure. Therefore, your ROI is going to be huge because you're not paying for all of those consumables. So, I mean, in my opinion, honestly, it's not the same at all. You're not going to get similar results with those devices versus this.
Very cool. So for this treatment, how do acne scars respond to it?
Acne scars respond extremely well. And like I said previously, how you can customize this treatment with putting down the Neo Elite first. Obviously, everybody has different acneic scarring. Some have pigmentation in their acneic scarring. Some have rolling scars. Some have really, really deep scarring. So it just depends on the scarring level that the patient has. And depending on that, you can, spot treat with Neo a couple extra passes in those areas to kind of help that pigmentation, the post-inflammatory hyperpigmentation in scars. Or you can do a couple more passes with the Neo Elite prior just to really remodel that tissue response underlying. So therefore, the scarring is getting almost buffed out and then going back through with that full ablation era. On top of that, you're only going to get your texture that much more smoother by doing so.
Awesome. So it does look like that is all of the questions we have. So I believe we'll be wrapping up the Q&A at this point. If any more questions still come to you guys or still trickle in, though, like I said, once everything is all wrapped up, those will still be answered at the end of everything. But yeah, Ashley, I just wanted to say thank you so much for doing the Q&A portion. And I wanted to ask you if there was any kind of last resounding statement you kind of wanted to leave our wonderful audience with.
Thank you so much for having me. I greatly appreciate you letting me spread my knowledge with everyone. I'm trying to think anything to leave you with. I actually was the photo of the one talking about my skin being smoother than my baby's bottom, and I'm going to be honest, it's true. I swear by doing at least one of these a year because of that. I'm out at my cottage in the summer a ton with my kids, and I just like to do a nice reverse at the end of my summer months. I just got done doing my reverse for this year 2 weeks ago, and I just know the outcome that's going to happen with this, and you hit a home run every time with it.
Awesome. Well, thank you again so much, Ashley. It was a pleasure having you.
You are so welcome. Thank you for having me.
Bye-bye.
Bye.